Hey everyone, this is Josh. I'm at the acupuncture clinic right now, and I just had a few more minutes before patients start coming in, so I wanted to make a quick little video about something that's really common, and it's been a little while since I've made one, so I figured why not. So a lot of people are coming in right now, and all the time really, but with headaches and migraines and things like that. It's probably one of the more common things. It's actually also one of my favorite things to treat with acupuncture. I think it does so well. So I of course always encourage you to come into the clinic too and get treated if you're experiencing headaches and migraines and things like that. There's a lot of smoke in the sky right now and things like that too, so that often will trigger these types of things, and just the ongoing levels of stress will do the same. So the first thing that I like to kind of check out and differentiate with people is what's causing the headache. And there's a couple primary reasons that we tend to get headaches. Get what they call tension headaches, which will experience as kind of like a band of pain that sort of can come across the forehead and will often wrap behind the ear and even into the back of the neck and down into the shoulders. So this is kind of a pretty typical presentation. If it's something that you get, occasionally or after a busy long day or a long week, or if you have a very stressful job, you can get these tension headaches. And, they're usually related to stress, overthinking, worrying, anxiety, all these kind of normal things. I always say this is life. That's what you're responding to. So very common to get tension headaches. There's a couple acupressure points that you can do on yourself that can bring you a lot of relief, and I like to use quite a bit. If I get a little tension headache, I'll often do them on myself. So just want to show you a couple options for tension headaches. Since we're getting a lot of this tension back here, is quite often it's coming out of the neck and shoulders. We really want to just kind of work on opening this area up. So a couple primary points I like to use is, I'll give you some of the acupuncture point names as well, so if you want you can look those up online as kind of a backup, but I'll also just show you. So one of my favorite points is a point called gallbladder 21, and the easiest way to find this point is just right on the very top of your shoulder, kind of the highest point on the shoulder, right kind of smack dab in the middle. You can kind of feel around a little bit to locate this point, and you really want to find whatever point feels the most tender in that general area. So if you find a really kind of squishy, ouchy point, that's a good location. Often these muscles will get really bound up and tight just from, again, life. That's what it does to us. And so this is a great point to use. It's nice that you can do it on yourself. If you have somebody to do it for you, even better. I often will do kind of both sides at the same time just by reaching across my arms like this. And I'll just hold these points. I'll find a good location and just kind of really sink into them. And just hold this really as long as you want. I'd say at least a minute or two is great. And you should really feel that shoulder start to relax and drop, and you'll feel the neck will release, and it'll just feel more open. I find these to be probably the most effective points. I like these points a lot, so I use these all the time, all day on people. And after a minute or two, you can also rotate and do a little bit of circles. If you want to just stick to one side at a time, no problem, do one side at a time. After that, you can move to this point called gallbladder 20, which is a nice little pocket right behind the occiput. So right where the neck connects to the head, there's a nice little divot there. If you look it up, the point is gallbladder 20. And same thing, you can just kind of hold that point there just for a minute or two. I'll often kind of do both sides at the same time, sort of like this, and it's where, hopefully you can hear me, where the thumbs meet, right in the back of the head. So that point too will really help to open up the neck and the head, which is a lot of what we want to do. We want to get that blood flow. We get really constricted by these muscles into the head, so we want to really open up the blood flow. Lastly, a point, it's not really a point that I love a lot for this, is just a simple hair pulling. So you want to be gentle with yourself, but give a little bit of pressure. It feels great. You just kind of get your hands in your hair just like this and just give some light tugs. You can pull in different directions, forward, back, move around in different spots, get your hair all nice and messy, and just give some slight tugs. If you have longer hair down here, I'll do down here as well. Do up at the front. I don't want to mess my hair up too much. I got people coming in. Pull the front of your hair. Just give some gentle tugs all over your head. This really basically what we're doing is just increasing the circulation through the scalp. It feels really good, and will help with these tension headaches a lot too. So that's tension headaches. Try to keep this kind of quick so we don't have to spend all day. Migraines are another really common headache. these can be triggered by all kinds of things. Hormonal issues is a big one. Food triggers is a big one. So if there's something you're really sensitive to and you eat, you can get these migraines. And sometimes even head injuries themselves. If you have an old car accident, something like that can also trigger this. Sometimes even just too much sensory stimulation, too much light, things like that can trigger some people too. So these are really common. They'll often appear just on one side of the head. You'll usually feel them, like maybe just here, often even behind the eye as well. My favorite acupressure points for this to do is, again, this gallbladder 21 point right on the top of the shoulders. And again, we're just helping to open up blood supply through the head, relax everything, let it fall down. There's a point called large intestine 4, which is very, very commonly used, very well known, very popular. And that point's located on the hand, right between this first finger and your thumb. There's this little V right here, and you just go right into the middle of that pocket. Large intestine 4 is right there. I'll often pinch it from both sides. I don't know if you can see that. So you get a little bit of pressure coming in from both sides. Again, I really like to just find the most tender spot in that little generalized area. It's about the size of a dime maybe, right? Right in that muscle, you'll feel it. Should be nice and tender. Fabulous point for any kind of headaches. Tooth pain, things like that. I've used this before myself when I had a big tooth problem a few years back. Lay some nice pressure on there. Give it a minute or two. Move it around a little bit. You should feel some good relief pretty quick. Then you can switch, do the other side, rub around a little bit, pop back and forth, treat both sides. If one seems to be working better, use that side. If they both just seem to be helping and your thumb gets too tired, just jump back and forth and it'll be good. Wonderful, wonderful point for headaches, any kind of head, face issues too. So TMJ, jaw tension, things like that, this would be great for you. And one other point on the hand I want to show you is called Sanjiao 3, sometimes triple burner 3 is another name. This one is between the 4th and the 5th finger, so the ring finger and the little finger. There's a nice little space right in there in between that joint space. And again, I'm kind of pinching on both sides here so that I can get a little bit firmer pressure. I want to just get a nice spot that, as long as if it gives you like a little bit of feeling, that's a good spot, right? This will particularly treat the headaches that are the migraines or any kind of headache right in the temple. So this area relates a lot specifically to the temple of your head. So this is another nice point you can use for this. So this gives you a couple options to bounce back and forth between. If one seems to be working, stick with that one. Often they'll all kind of play a little bit of a part. So, and lastly, I want to talk about sinus headaches. These are another really common thing, again, with the smoke and everything going on right now, allergies, all that kind of fun stuff. And you'll often, if you get the headaches that are kind of right in the forehead and into the eyes and in the nose and sinuses, those are most often going to be your sinus headaches. You might be stuffy, you might be runny nose, you might have nasal drip. There's a couple different variations of it, but usually the frontal headache right here is going to be related to the sinuses. And in all these cases too, I always encourage people to drink a lot of water. Sometimes it's just a little bit of dehydration or being a little bit tired. But if you do have a sinus headache, my favorite point is going to be this point right beside the nose. It's called large intestine 20. There's also an extra point there named B-tongue. But if you look up large intestine 20, it'll get you pretty close. Just to the side of each nostril, right? You'll find a nice little divot right below this, this bone right here. There's a little bit of a space, and it should be a little bit tender too. I really like to pull this out like this and just kind of draw it along the sinus, and then we'll maybe hold for a minute or so and do a little bit of pressure. A couple circles in each direction. This should feel really nice and really open up the sinuses. So particularly if you're really stuffy, this point should do you a lot of good. I also like, there's a point bladder 2, which is basically just the inside of your, or the inner portion of your eyebrow, right where the eyebrow ends. There's a little bit of a divot there too, so if you can find that, it's really nice. You can use your thumbs like this, or you can use your pointer fingers, whatever feels most comfortable to you. It's a little bit of a sensitive point, and again, I always like to find that sensitivity. So if it's sensitive, bingo, you're in the right spot. And just hold with a little bit of pressure right there. Give it a minute or so, a couple circles in each direction. You can also pull this apart a little bit too, just to, again, encourage the sinuses to open up and let that gunk flow. And then there's also a point right in the middle too that you can do. This is an extra point named yin tongue. Very nice point, calming, relaxing as well. Sometimes if I have sinus pressure, I actually like to lay down on the ground and kind of put my head into the ground. And that pressure is a really nice way to work with this too. And then the last point for the sinus headaches that I like to do is going back to that gallbladder 20 point. So right at the occiput, right at the right where the skull kind of meets the spine. There's a nice little divot right there. This, again, especially if there's nasal drip and kind of getting that stuff gunk into your throat and that kind of thing, this is a great way to treat that. So, and then as always with all types of headaches, again, this large intestine 4 point on the hand, wonderful point for any kind of headache, any kind of issues with the face. So I hope that's helpful. Let's see, how long did we go? 10 minutes. All right, a little bit long, but hopefully not too long for you. Again, I'd always encourage you to come in and get some acupuncture. You know, I'm a big fan. I'm a little bit biased, but I'm a big fan of acupuncture for any type of headache. So hope you all are staying safe out there and feeling good. And we're here at acupuncture.com. If you want to schedule an appointment, come in and see us, and we'll hope to see you soon. Take care.